All right, so I'm going to be giving a report on room 301, Straya Hatchett. She's age 31, female. She was admitted to 22, and she's being covered by Dr. Sangerston, which is her surgeon. Previous report didn't mention it, but I believe she is full code. She has no known allergies. She has no isolation precautions. And I believe her illness severity is, she is stable right now. The only thing we're watching is her temp, which is slightly elevated. So she came in with a rule out of appendicitis, and she ended up having an appendectomy. And so she's currently second day post-op appendectomy. She does not have any significant medical history and course of stay. Like I just said, she had a successful appendectomy performed. She is ANO times 4. Last I checked, 20 respirations. O2 is 99%, room air. Didn't get from the previous nurse report on her rhythm, but she had blood pressure of 108/74 and then a pulse of 92. Didn't mention her last bowel movement. She was MPO with an NG tube, but then the doctor later switched it to clear liquid, and the NG tube was on low gravity suction. She has a IV in her left forearm, running D5 1/2 NS with 20 KCl at 125 milliliters per hour. Her skin is clean, dry, and the wound is intact and dry. Mobility, she is I believe standby assist or times 1. She's able to move, but we just, of course, after surgery want somebody there. Fall risk is moderate, and bed alarm is on. There were no diagnostic tests, but I'll go over what I would have liked to see and what I would expect. And there were no labs mentioned either, but I'll go over that again. Currently, there's no discharge plan. The doctor's was originally going to see her today, and when he came, he ordered the NG to be removed, and so that's when she switched to clear liquid. So the NG order was removed. She does not have a current VTE prophylaxis that I was made aware of, so I'll go over what I would expect. And then situation monitoring, doctor didn't want anyone touching the dressing, and we were supposed to monitor the temp, which was at 101.2, and she's getting antibiotics every 6 hours. And the family is at bedside. So moving on to competency 2. So brief overview. Appendicitis is an inflammation of the appendix, and when it becomes filled with pus, it's often caused by blockage in the appendix. It's treated with surgery, and if this is not treated, the appendix can burst and sepsis or systemic infection can occur. So for this patient right now, everything seems at baseline except for the temperature. So we want to monitor that, and I would want to administer the antibiotics and antipyretics for the fever at appropriate times, and then perhaps give ice packs if she begins to feel the symptoms of her temp. Right now, she was doing fine, so she wasn't having any issues. She actually was at one point diaphoretic, but if she's like that, I would just treat it with the ice packs, perhaps, and maybe less blankets or no blankets. I think I'd like to see OT for this patient so that they could assess the patient's ability to perform ADLs, because she's been asking about wanting to go home. And a complication for this patient is risk for infection related to the removal of her appendix, or surgical intervention, as evidenced by an increased temperature and possible increased white blood cell count after labs are drawn. And so that's going back. Labs I'd like to see her white blood cells, and I would expect those to be slightly elevated because of her high temp. I'd also want to know potassium, because while her blood pressure isn't bad, the systolic is kind of low at 108, and so an increase in potassium can is related to a decrease in blood pressure, so that'd just be good to know. And I'd want to know hematocrit and APTT for heparin, so that we could give her a VTE prophylaxis. Going back to the complication. So, as evidenced by increased temp and possible increased white blood count after the labs are drawn. Infections are common following an appendectomy, since an abscess can form in the abdominal cavity. And then this would cause it to burst, and then you could have the sepsis. And then also surgical site infections are pretty common with these, or just are an issue because with any open surgery, you can have improper wound care and inadequate use of antibiotics, so bacterial infections can occur. The drugs I would like to see, also for diagnostics, I would guess that pre-op, she would have likely had a abdominal X-ray, CT, or ultrasound, that those would have confirmed the appendicitis, and then it would have moved along to having the surgery. The drugs I would like to see are ibuprofen or Motrin, heparin or Heplock, acetaminophen, Tylenol, cefuroxime or Zenacef, and metronidazole or Flagyl. So ibuprofen, she'd be getting this for her temp and for management of any pain. It inhibits prostaglandin synthesis. Some adverse effects are heart failure, MI, stroke, hyperkalemia, and GI bleeding. And we could, hyperkalemia, I'd already asked for the potassium, so that'd be good to know as well for that. It's important to monitor pain and then the temperature, and if she's showing signs of a fever. This is contraindicated in a severe heart failure and active GI bleed. Heparin would be the anticoagulant, and so it'd be used for the VT prophylaxis post-op because clots can form easily after something like that. It potentiates inhibitory effect of antithrombin on factor XA and thrombin. Some adverse effects are bleeding, fever, and anemia. And it'd be important to assess for signs of bleeding from the patient. And it's contraindicated when the patient has open wounds. And I'd want to monitor the APTT and hematocrit, which I asked for. Acetaminophen or Tylenol. And for all these, I'm not sure the exact dose, because I'm just not really sure exactly what the correct one would be. And this would be for pain, and pain. It inhibits synthesis of prostaglandin, similar to ibuprofen. Some adverse effects are hypertension, hypokalemia, muscle spasms. And we'd want to know her pain level before, and also it can help with fevers. So again, fever. And you would not give this if this patient has a severe hepatic disease, and she does not. Cefuroxime is a anti-infective, and this drug and Flagyl are often combined and given for appendicitis. And cefuroxime is for a range of infections, and for her it'd be the appendicitis. It binds to bacterial cell wall, causing cell death. Some adverse effects are rash, urticaria, nausea, vomiting, diarrhea, and bleeding. Be important to assess for signs of anaphylaxis and monitor. Don't know what I wrote. My bad. Monitor for hypersensitivity reaction. That's the big one. And then it's contraindicated if the patient's allergic to cephalosporins or penicillins. And then the last one, metronidazole or Flagyl, is another antibiotic, and this is often combined with cephalosporins, which the Zenacef is one of those. And this is for intra-abdominal infections, and for her, the appendicitis. It disrupts DNA and protein synthesis in susceptible organisms. Some adverse effects are pain, anorexia, nausea, vomiting, diarrhea, and dizziness. Monitor ions and O's and neurostatus, and use cautiously in the history of seizures and neurologic problems, and she doesn't have any of those, so we're good to go. Comp 4. The patient seems to be recovering well, and while no discharge plan is yet in place, it's important to start to discuss an at-home treatment after an appendectomy, since the patient is asking when she can leave. I found a John Hopkins medical article that explains at-home care and details how the procedure was done and what to identify as adverse signs after the surgery to report to your healthcare provider. So that'd be a good resource for her to use. And then Comp 5. So I got in the report that the patient has constantly had family with her. Excuse me. And so this can be an excellent social factor that can help with recovery, because if the patient has family constantly with her and they're eager to help, it can make the recovery much smoother than if she was doing it completely by herself.